Hi, Dr. Izan again, here with Virtual Medical Scribes, now trying to put it all together in our fourth session. So understand that there's three reasons for having the healthcare records. Again, patient care, billing, and medical legal. We'll talk about some of the new aspects of that. So understand that in the note, there has to be alignment of the chart note. The chief complaint has to match the history of the present illness, has to match the objective, has to match the medical decision making, has to match the diagnosis, has to match the plan. So alignment's very, very important. Be careful of bloat note. Don't just cut and paste. Every word is important and is discoverable in a legal situation. So understand that there's a lot to be done. A lot of times you'll see abbreviations for very long words, and those are another challenge that you're going to need to learn those sort of things. So everything should be in alignment. Again, chief complaint has to match the history of the present illness, has to match the objective, has to match the medical decision making, the diagnosis, and the plan. So understand too that you're going to be working with doctors and other healthcare providers, and there is a challenge to doing that. You have to keep your ears and eyes open to what they're going to be saying and what they're doing. Do not take anything personal. Sometimes in the heat of a patient encounter, they may not have the time to be as patient with you as you would like them to be. The thoughts are that it's a very serious situation in terms of taking care of patients, and it needs to be treated in a very professional manner. And then understand that, I know you guys are all smart, but understand you're smart, but you're not necessarily trained in this. You don't have experience. So be open to continued learning. And then some of the ways you can learn, especially as a medical scribe, is understand there's different thoughts on what's the best way to learn. In this book called the Talent Code, they talk about 10,000 sort of repetitions to get good at it. I'm not saying it's going to take you 10,000 patients to get good, but understand that repetition is the mother of skill. You have to keep practicing, learning, getting feedback, and be open to that feedback. And when you work with doctors, understand that a doctor talks to you, have a notepad ready to go whenever they're talking with you, or have your computer ready to go. And then we do have high expectations for you as a nurse, pre-med, or other providers. So their expectations are high. Ideally, try to match their intensity. And then understand that little mistakes can be life-threatening and even cause something called malpractice to be accused of. So if you can get the simple things right, that will keep you in good stead. So I start with gender. You have to decide if the patient is identifying as a male, they need to be put down as a male. And it's really tough if the person is a female and you put them down as a male when they don't identify as a male. So bottom line is get the gender right to start with. Left versus right, that's very, very common to be mixed up. So gender and laterality, left versus right, is very important. So be very, very careful. And we in medicine are trying to prevent different what's called wrong-sided things. So the side becomes very important. So understand it's the patient's left and right. So you have to understand that you have to be very compulsive to get those two things exactly right every time. It can never be a mistake on that. And then you have to be careful that you get the note done, and it's really just a grind. It's very difficult. Doctors, we spend many hours at night trying to get the chart exactly right, and understand you as a scribe have to be very, very compulsive and diligent to get the chart right. And then you want to be part of the team. Sometimes that's a little challenging in a stressful situation, but understand that the chart is something that's very important for healthcare. And so if you want to help the patients, you help the doctor by getting the chart exactly right. And I truly believe my life begins when my chart note's done. So I will spend sometimes hours at night if I don't have the help to get the chart note right. And then understand that you don't have to know everything about the disease, but Wikipedia level knowledge is not too bad. So if you're going to be seeing a patient with diabetes, maybe look on Wikipedia for what the diabetes is so you know enough about it so that you can help the physician. And then what you're trying to do also, especially if you're thinking of going on in medicine, is you try to come up with, anticipate what the physician might want to do for his diagnosis, and then you become a better part of the team. I love Sherlock Holmes. It turns out Sir Conrad Arthur Doyle, who wrote Sherlock Holmes, was a physician, and that observation is very important. So if you get the time, I encourage all medical scribes to read Sherlock Holmes, at least watch some of the movies, and just understand that these are the kind of things we as physicians are looking at, different clues to pick up on the diagnosis. This is a great TED Talk on the importance of the physical exam. And so by you being a medical scribe will allow the physician to spend more time with the patient in quality time, especially on the physical exam, which is very important. So then I just want to then finish up with pearls and pitfalls of medical scribing. These are some of the good things a good scribe does and some of the bad things a scribe does. So it starts with medical legal. So understand that in the United States, there's 1.34 million active attorneys in the United States. They make up 40% of the world's attorneys, but we in the United States only make up 4.4% of the world's population. So there are a lot of attorneys out there versus the physicians. And you on the TV or other places will see these ads that talk about how good these new medicines are, and then right afterwards a medical legal sort of case that's going about them. So most everything in medicine is very legalistic, and you have to be very, very careful about that. And we sort of use this thought that the last person to touch that patient might be it. So understand that physicians are very compulsive about getting the documentation correct, so it accurately reflects the treatment that was done to the physician or to the patient in case, number one, they need it for further medical use, but also in the event of a what's called a tort or a medical legal case. So you can go to this link and look at a mock trial and see what the physicians go through when they get grilled in court. And you'll see in this video that they just talk about one visit 4 years ago, and all they have is the medical record. So that's how important the medical record is. This is a Kahoots you could play. And then in terms of the chart notes, you'd like in a perfect world that the chart note's done within 2 hours. You can see like this chart note was signed at a certain time. And so you'd like to get your chart notes done so that you could be in a contemporary manner. And then that they're all legal documents, and you have to be very careful what you put in the note and what you don't put in the note. And this is some diagnosis that was someone coming in for a problem, and that was not documented in the chart. And so again, you just want to have alignment to it. So, and then as a medical scribe, you want to dress appropriately. I'm real big on name badges. So if you're going to introduce yourself to the patient, it's nice to have a badge so they know your level in there. Be attentive in the room. And I think everybody over the age of 20 should be addressed by their last name to further show respect. And then in general, getting a job as a scribe, you want a good curriculum vitae, which is, most people call it a resume, but curriculum vitae in Latin means your scholarly life. You can get certifications in scribing, and you could do additional education on it. So understand that the more patients you see, the better you will be. You want to get feedback and be open to feedback. Best place to become medical scribes, the emergency departments, urgent cares, primary care, family medicine places. And then I encourage you to be culturally sensitive. If you're in a place that has a lot of Spanish speakers, consider being medically Spanish certified. And there's places that will do that online. So my mission statement for my personal practice sort of reflects my thoughts on the way to improve healthcare. I think we need to treat every patient with respect. I think we need to use the best medical practices to improve access to quality healthcare in a culturally sensitive manner. And so that is my goal of my career. There are a lot of good books out there. This whole series on, there's a general ultimate medical scribe book, and then there's particular books for whatever subspecialty you might be in. There's other books out there. I do have a talk on the attending model of medicine, where I, with my team, become more of an attending than sort of a rank and file worker. This is some new ideas on how medicine is going. And again, if you're looking for the future of medicine, I encourage you to read this book. This is the part about telehealth type medicine. So as the world goes out, there's over 1 billion people who haven't seen a physician. We're trying to reach out to them, and using computerization, including telehealth, may be the way to go. Eric Topol's a thought leader on this. He's written several different books that are quite good. Again, I like this book as a novel to kind of understand the stresses of a young physician go through. Atul Gawande has a series of different books, and Being Mortal is about end of life, so hospice type care and advanced directives are going to be very important as the future goes out. And then finally, Malcolm Gladwell has several different books that go along some of the rationale for why we do certain things and why things take off. And then this is a book that I wrote trying to do improve men's health. And so the goal is to continue to improve your profession. What we encourage you to do is to become a lifelong learner. CANI is constant, never-ending improvement. All of us need to continue to get better, and together we can help to help the patient. There's a lot of different resources. Be careful not to do more than what you're trained to do. This now becomes where if you're a medical assistant and a scribe, you can do more. So this is what a medical assistant can do in California. They can draw blood, they can administer shots, but as a straight scribe, you're not able to do this. So I do believe that doctors save lives, but I think that scribes save doctors. So we really need you. Keep learning, get better, and let's improve access to quality healthcare. Thank you.